Do my kids know all of these like old nursery rhyme tales? Like, I don't think they do. I'm like, I deprived my children of these like terrifying tales. Like Humpty Dumpty, which was like,
Yeah,
he fell
fell
off
off
a
the
wall and he
wall
was
and
like,
cracked his head.
he
Yeah.
was, yeah, I mean, he was dead. The information shared on this podcast is for general educational purposes only and reflects the host's personal views and experiences. It does not constitute medical, legal, or financial advice, and no professional relationship is formed by listening to this podcast. As always, consult your own qualified advisors regarding your specific needs and practice. Thank you.
Hey, Dr. Soyka, how do you like my hair today? Got it
Hi,
straightened.
Sonia. You're looking fancy. We're recording on a Friday today, so if you see us with an extra smile today or hear us with some extra pep in our step, it's because it's almost the weekend.
It is the weekend and we get to see each other soon, hopefully. Fingers crossed. At
Yeah,
Scrubs
yeah.
and Heels, Dallas, Texas.
Whoop, whoop.
Yeah, yeah. Props to Kiki for like doing a fab job on my hair today. Super curious to hear about today's topic, which is IBS. So why don't you tell us what IBS stands for?
So IBS is Irritable Bowel Syndrome.
Hmm.
And I know last episode we talked about IBD, which is inflammatory bowel disease. And
Yep.
so they're two completely different phenomenon and managed differently, diagnosed differently, and just completely different. So irritable bowel syndrome is a clinical diagnosis. So in IBS, what that means is if I do a colonoscopy on you, it may
Hmm.
look completely normal, and you
Hmm.
could have the most severe case of IBS out there. It doesn't look like anything
Hmm.
on colonoscopy, on CAT scan. It's symptom based diagnosis.
Okay. And what are I think about four members of my mom's family has IBS. So help me to understand the symptoms.
So there is actual criteria, and I don't want to screw it up because there's this thing called the Rome criteria, and I'm not a spring chicken anymore, but over the years it's been like Rome 2, Rome 3, Rome 4. So every, few years they update the criteria. So I think we're currently in Rome 4 criteria,
Hmm.
and I just want to make sure that I am doing it justice. So I pulled up IBS and I have the Rome 4 diagnostic criteria in front of me.
Okay.
And it says for irritable bowel syndrome, the diagnostic criteria is recurrent abdominal pain on average at least 1 day a week in the last 3 months, associated with two or more of the following criteria: that the pain is related to defecation, so pain related to having a bowel movement.
Hmm.
Two, that the pain is associated with a change in the frequency of the stool, either more constipated or more diarrhea than usual.
Hmm.
And or three, associated with a change in form of the stool. So remember we talked about how in previous episodes how, we characterize diarrhea not just by frequency of stooling, but also remember we looked at that Bristol stool
Yeah.
chart and all of that. So if you have a change in the form, like you were having nice form stools and now all of a sudden they're liquid, that would associated with pain and the pain with having a bowel movement for the last 3 months, at least 1 day a week, that qualifies as having irritable bowel syndrome.
Okay. So yeah, my mom's like at least four people in my mom's family have this. So growing up, there was always an urgency to use the bathroom. Like we'd have to pull over a lot. We have to be thoughtful about long road trips. She doesn't eat before she goes on any trips, or if she's anxious, she needs to like the urgency. What do you guys call it when you just have to go? Bowel
Yeah, you're
urgency?
right. Yeah, fecal
Yeah.
urgency or bowel urgency.
Yeah, and we were really tough on my mom. We just thought she was like anxious or paranoid. Like we didn't know she had a diagnosis, right? Like, and then four other members of her family have it. So yeah, sorry, mom. We were jerks.
I mean,
Yeah.
I always tell people, I think we all have a little touch of irritable bowel syndrome, right? And I explain it to patients like, and that's not to make light of people that have and struggle with serious IBS, but I like to define, and there's no sort of real way of saying exactly what causes IBS and what, how to fix it and all these things. But I tell people, in my opinion, as a gastroenterologist, I think it's kind of I look at it as like three different things that
Mm.
impact or play a role in irritable bowel syndrome. And one is the fecal microbiome. Okay, so what is the bacterial makeup? Two, something called increased gastrocolic reflex. So what that means is your GI tract is speedy. And this is more for IBS-D or irritable bowel syndrome diarrhea predominant type. But what that means is there's a messaging system in the GI tract where the stomach sends a message to the colon once it sees food. Hey, you're about to get a load here. Get a
Mm.
move on. And that reflex is much faster in patients with IBS, especially IBS-D. And
Mm.
then the third sort of arm of this is what we call the brain gut connection. And that's probably the most impactful arm, but definitely I think the one that people struggle with the most to understand. And I kind of explain it to people like this, and I know I'm talking a lot, but I do think it's an important foundation to lay. What I explain it to patients is, okay, so tell me, Sonia, when you are nervous, let's say you're about to give your speech at Scrubs and Heels.
What goes on is like sometimes my palms get sweaty. Or forget the palms, like my armpits again. Remember the Saturday Night Woman, Molly Shannon, when she goes like this?
Oh yeah.
Like
Oh,
I'm
I
like
remember.
the pits get sweaty and like I get like tunnel vision. Like I kind of go in a little fight flight mode.
What happens to your heart rate?
It's elevated,
What happens to your breathing?
shallow.
Okay, rapid shallow breathing, right? So as humans, we are very aware and accepting that, okay, yeah, our skin is going to affect, right? We're going to sweat. Our heart's going to be affected by nerves. Our lungs are going to be affected by nerves. We're like somehow okay with this, but in the GI tract, it's like a foreign concept. People are like, what do you mean? I'm also going to have, you know, GI effects. And I'm like, yes, because it's innervated by the same nerves that the heart and the lungs and the skin. So it makes sense, right, that you would have these side effects associated with increased neurotransmitter signaling. So I'm just going to say anxiety in that setting. Now, let's say you have a situation that's increasing your anxiety, right? You're dealing
Mm,
with a family member that's going through a health issue, or you're going through a health issue,
mm,
or you're moving, or, things like, and so all of a sudden what happens is you have this sort of chronic anxiety, right? It's not like you have to go up there and give a speech. There's this underlying anxiety that's present. And so the neurotransmitters are being submitted or secreted rather much more frequently all the time. And so that's giving feedback to the GI tract constantly to be heightened, on heightened alert, heightened alert. And then sometimes, even when that situation resolves, like you're no longer, that the family member's not sick, whatever, but the feedback loop is already established. And I tell people it's very hard to break, right? Because what happens is the brain tells the GI tract, oh my God, I'm stressed out, fight or flight,
yeah.
and so what happens is the colon starts squeezing and you're having diarrhea. And so then, an abdominal pain. And so then a message goes back to the brain that says,
Yeah.
oh my God, I'm having diarrhea and abdominal pain. And the brain's like, oh my God, I'm stressed. Send again the hormones. And then, so it's this feedback loop that sometimes requires a lot of different things to break. So that's kind of how I explain irritable bowel syndrome or IBS to patients.
So I love that. Like that sums up my mom, and sorry again, mom, I feel like such a shit child. Um, I do because when
I
I have
mean, you are literally a shit child.
to Sorry. Yeah. So yeah, like when I have to go for my colonoscopies at UCLA on the 405, my mom was really sweet. She's like, let me come with you. But between her IBS and my IBD and trying to prep for a colon, I'm like, I can't do this. Like, I can't make two stops just to get to UCLA to accommodate to your IBS. So we'll talk about some of the micro strategies of dealing with IBD and IBS. But what are some of the remedies? Like, how do you teach your patients to manage it? And then I'll talk about how my mom and I manage it.
Yeah, so I think I like when I sort of lay that framework for people, I talk a little bit about, all right, here's the three sort of things that are driving it. So
Mm,
one is focusing on that arm, right? So focusing on fixing that, resetting that brain gut connection.
mm.
And that can be through a variety of things. There's, CBT or cognitive behavioral therapy.
Yep.
There's, any multiple different kinds of psychotherapy. There's meditation, yoga, centering techniques, breathing exercises, and then there's medications. A lot of people require medications to reset those neurotransmitters that are being sent too fast or too rapidly, and that's okay, right? I tell people that doesn't necessarily mean we're going to be on this for life, but
Mm,
we need to reset some of these pathways. So that's one, focusing on that pathway. Two would be, we talked about the gastrocolic reflex. So there are medications that can slow down the reflex. There's a kind of medicines called antispasmodics. Dicyclamine and hyoscyamin are two of those. And those slow the reflex, but they also help with the pain component of things. So
mm,
they are smooth muscle relaxants. So when you're having a lot of cramping, they can really help decrease the symptoms of the cramping.
mm.
Also, sort of in a natural way, I think we might have spoken about this in one of the episodes, but um, peppermint does the
Yeah,
same thing. So
I love
peppermint
pepper.
is a smooth muscle relaxant. And so I recommend, peppermint, especially encapsulated peppermint, which is a compound or a package called IB Guard, which you can get over the counter at like CVS or Walmart or whatever.
Hmm.
Um, but that can help relax the smooth muscle because the colon is a smooth muscle. And so that can help with that. And then the third is the fecal microbiome. And that's, the old phrase, you are what you eat. That's essentially what that means. And there are different ways to incorporate bacteria and try to change the intestinal makeup to skew more good bacteria instead of bad bacteria. And some of those strategies are like trying to use probiotics, um, trying to slowly incorporate foods that have good bacteria. So I tell people like focus on eating foods that grow in the ground and are natural. So all these foods that are just like processed with preservatives, they're filled with chemicals and have bad bacteria. But especially foods like fermented foods,
Yeah, it's called
kefir.
fee fi. What is it? Fee fi fo now, or it's a
I
fake.
don't even know what the words are, but feed the fecal microbiome.
It's
We'll say that.
well, I have two clarifying questions. So,
Yeah.
microbiome, I heard at the UC Irvine talk like it's a symbiotic system. Like you love it, it loves you back, right? Or it's like,
Sometimes, I mean, yes, you want to be one with your fecal microbiome, but that's not always easy to do. And, there's like all these companies and things that say like, oh, send us your stool and we'll tell you, what you're deficient in from an organism standpoint.
mm,
And the problem with that is who's the standard? How do they know what your fecal microbiome is supposed to be, right? It's different for everyone. So
mm,
my ideal fecal microbiome is probably not the same as your ideal fecal microbiome. And my ideal fecal microbiome today is different than what my ideal fecal microbiome was 20 years ago. So how do they know? Who are they comparing you against? Some guy who moves his bowels every day eating McDonald's in Ohio? Sorry to my Ohioans, but I mean, I think that's the problem. So we don't necessarily know what, you're deficient in, but we do know that fermented foods have a high bacterial load. But that doesn't mean like go home and slam two kefirs, right? You're going to be
Mm.
filled with bacteria and feel like absolute shit. So this is a slow and steady process, and you're going to feel gassy and you're going to feel bloated because you're eating bacteria, right? But eventually those bacteria will incorporate into the lining of the GI tract,
Mm.
and, slowly your good bacteria will outweigh the bad bacteria.
So yeah, I just heard it. I think Dr. Suchdev was talking about it at UC Irvine. It's called Fei Fi Fo Fum. It's a study by Stanford Medicine. High in fermented foods, fiber. Um, I don't know what the Fo Fum stands for, to be honest. But I just thought it was like that Fei Fi Fo. Like I don't remember which giant did that or something. It was from a kid's.
I don't know. Yeah, the Jolly Green
Yeah,
Giant. Fee
Fee
fi
Fi
fo
Fo.
fum.
Maybe it was the Green Giant. Do people even know who that is? The peas guy? I don't know.
Yeah, I don't know. I mean, I was thinking about this not the other day. Like, do my kids know all of these like old nursery rhyme tales? Like, I don't think they do. I'm like, I deprived my children of these like terrifying tales, like Humpty Dumpty, which was like,
Yeah,
he
fell
fell off
off
a
a
wall and he
wall
was
and
like,
cracked his head.
he
Yeah,
was, yeah, I mean, he was dead.
I
I mean,
know.
I think
Childhood is tough.
we're too light on them now. They don't even know.
I
Don't
I, I
sit on a
agree.
wall. Don't
I
sit on a
agree.
wall. You're gonna crack your damn head.
I agree. I think a couple of physicians, Dr. De Silva, everyone's been telling me because Stellar is a great drug, except it's not as strong as Remicade. So I've had to be much more mindful. Like when I went a little rogue and ate too much bad Halloween candy, not that, whatever, like post-latent adolescence here. We didn't get to go trick-or-treating as kids. So I've told my friend Melina, take me trick-or-treating in my Elmo pajamas. And the doctor, Bantala, was telling me, listen, you just have to be a little bit less harsh side effects, but you have to be more mindful. So I've been eating yogurt every day, which Kiki said's been doing fab job on my hair, but I make it from scratch, like the Indian way, like boil it. It takes 10 hours. Damn good though. Yeah, it's a whole process, 8 to 10 hours. But I've been eating more like yogurt every day. I know one of my sister-in-law's dad eats like sauerkraut, or
That's what
people
I
like
like.
kimchi, but
I love
how
it.
much is too much? Like I like help me to
I mean,
understand.
I tell people there's really no limit, but the point of the matter is introduce slowly.
Hmm.
Because if you just like go to town on a container of kimchi, which they sell at Costco, so that's like very easy to do. And I think the Costco kimchi is pretty good, but I've been told by my Asian friends that I'm like a wuss or something because it's like not that good, but I don't know. I mean, I think it's pretty decent. But anyway, I would say, if you just go to town on that huge jar of kimchi, like you're going to feel like ass. But there are probably people who, Korean people who eat a significant amount of kimchi every day and their GI tract is fine. So eat to feel, right? So if you're farting up a storm and super bloated, that's too much. Dial it back a little bit, right? And
Yeah.
go slow. I usually tell people like start with, 2 tablespoons of something. 2 tablespoons of kimchi, 2 tablespoons of sauerkraut, 2 tablespoons of kefir. Start slow. The worst that can happen is it's not helpful, but at least you won't be, like a farting balloon all day feeling like absolute crap. So just go slow. There's no rush. It takes a long time to fix the microbiome that way.
Okay, yeah, I've been taking notes. So it's the gastro reflux, the fecal microbiome, brain gut. What else can? Yeah, what is the difference between? I'm so confused. What's a prebiotic? What's a probiotic? I'm very confused. What's a VSL3? Like, what am I doing here? What is this all?
Um, that is a good question. And we could kind of have an episode on all of this stuff, but
Yeah.
I'm just going to summarize it as this. Pre and probat, they're all bacteria. Our
Okay.
gut needs all of them, and
Well,
both of them are healthy for the gut. VSL number three is a specific formulation of probiotic that there's been like hundreds, maybe even thousands at this point of studies, where I say this, and I feel like I say this line in every episode, but like, I'm a scientist, I love data, we're all scientists, we love
yeah.
data, and that's good, right? We want to love data. But there's been almost probably 1,000 studies at this point looking at probiotics in fixing every condition. Ulcerative colitis, Crohn's disease, irritable bowel syndrome, you name it, right? And
Hmm.
zero, except for one, have shown any efficacy. Now, that being said, if you look at these studies, I tell people there were people that benefited. So,
Mm.
why were there people that benefited when they were on it? Well, I think it's because those people just happened to be deficient in
Mm.
whatever the composition of that probiotic was. Like, let's say it was Saccharomyces and bifidobacterium that was in, that they were getting. Well,
That's
those
quite the
people just,
mouthful right there. What
right,
did you
I
just
know.
say?
They're all like the longest names ever, but suffice it to say, they were obviously deficient in those bacteria, and so they got better. But that's what I'm saying about the fecal microbiome. We don't know what you're specifically deficient in, and there's no way of figuring that
Mm.
necessarily out. So those people did benefit, but there just wasn't enough of them for it to be statistically significant. So I do think that there's sometimes like a trial and treat strategy. Like, I'll tell people, try a probiotic, and see if it works. If it doesn't, it just means that you're like, whatever the bacteria that were in that probiotic, you weren't deficient in them. So see if you can find a probiotic with something else in it.
Mm.
So that's kind of, I think that's kind of the only efficacious strategy in my opinion. Now, I feel like there was another question there that I've already like lost track of, but anyway, that's my sort of 2 cents on the pre and probiotic. Oh, VSL number three is the only study that's shown efficacy, and that was specific to a group of patients called patients with pouchitis, which is a subset of inflammatory bowel disease. And, I don't know. Maybe that means something, maybe it doesn't.
Mm.
But because of that, it got, a lot of notoriety for being the best.
Okay. Yeah, one of the other physicians told me about it. So here's my like rant about like when you're a patient. So, when you're struggling with IBS, IBD, people are very not physicians. I just want to qualify. Regular civilians are very like, well, did you try going vegan? Did you try this? Did you try that? Did you try, let me give you a cookbook. And you know what worked for me? Did you try smoothies? And I kind of want to go, like, fuck off. Like, what worked for you isn't going to work for me. And between my physician and my registered dietitian, we're working on it. So I love what you're saying is that everybody is different. So what worked for you may not work for me. And I'm a nerd. I like the research. I like the science. I like testing on myself. But if someone's got IBS, IBD, or Crohn's colitis, like ease up. Like we've got usually like there's a lot. Or I remember some people would just send me articles and I'd be like, I don't, and this is me, I didn't find it helpful. Like one person sent me an article and said, the reason why you have colitis is because you never got pregnant. And I was like, why? How would you send this to me? Or like, or like, my friend's friend, like, I don't know, the struggle is real. And the last thing you need is more reasons for like root cause, you know? And I know people are coming from the spirit of being helpful. So I just want to encourage patients like, dude, you got enough on your plate. Just say thank you, delete. Thank you, delete, or set a boundary, which I learned from cognitive behavioral therapy, which is I so appreciate you trying to help. Going forward, I'm going to just rely on my like care team at UCLA or something, because it is like everyone like cookbooks and all this stuff. And I know you're coming from the spirit of being helpful, but each person is different and they might not find it very helpful. Like, and there's no science backing to anything that they're sending my way.
I mean, as a gastroenterologist, I feel like many times people, when they come to my office, they're clearly struggling. It's not like they just had a bad day. And, first of all, I think my next appointment's in like 6 months. So I think they've been waiting, and we have these conversations and people are upset and they're emotional about it. And I say a lot to people like, this is not some moral failure. You did not. I imagine by the time you've landed in my office, you have tried going gluten-free and drinking a smoothie and trying all the supplements. And, most people do, right?
Yeah.
Because you want to feel better and you want to do it naturally and you want to do the right thing. And maybe it's you. And if you just did this and if you just had more water and if you just ate the right foods, right? And of course, there's some stuff that advice I can give and nutritionists we can talk to and all, but it's not a moral failure to have irritable bowel syndrome. And there's a lot of different medications and treatment strategies that we can employ to try to fix this. And so that's why I sort of mentioned very early on in this talk, like, yes, sometimes cognitive behavioral therapy works, but sometimes we need actual medications to reset the gut-brain axis. And that is not a moral failure on your part to need that. It doesn't mean you have failed. It means your body is failing you. And we need to fix that. And so I feel like that's very important. And if people get any message from me from this, I hope it is that. Because IBS is not a moral failure, and you don't have to struggle alone, but be open to fixing your body so that you can feel better.
Yeah. The same thing for the IBD. Like we
Right.
we didn't like people are like you did this. I'm like I didn't do anything. It happened. Like literally shit happened.
And you know what, Sonia? There are studies that show, I think it's somewhere up to 50% of patients with IBD also have IBS.
Yeah. Yeah.
So sometimes it's hard, right? Like, is that then when patients are calling me, they're in my office and they have Crohn's disease, and I'm like, well, is it the Crohn's that's flaring? Is it the IBS that's
Yeah.
flaring? What's happening? We're trying to sort it out. So that could be complicated too. So that's another thing to remind patients is that just because you have one doesn't mean you don't have the other.
Yeah, no, very true, very true. Let me share a little bit about the lifestyle changes my mom has had to make as an IBS, and I'll talk about some of the IBD lifestyle changes I had to make. So yeah, I just discovered cognitive behavioral therapy. It's a game changer. Like it's been uh, life changing. So everything that I teach in corporate America, like the classes on how to give and receive feedback, how to handle your triggers at work, it all stems from cognitive behavioral therapy. Just in corporate America, people have repackaged it to make millions off of it. So it's been a life changer. Oh, we're getting a book? What are we
I was
getting?
going to say we could make a little plug here for GI psychology. Um,
Oh,
one of
we
one
can't
of
see
the
it.
oh, that's okay. It's one of our favorite people who's always at Scrubs and Heels, and this is the company, and they do cognitive behavioral therapy virtually. And so I love this little pictograph that they have, and it kind of goes through how does CBT help treat or reset the gut-brain connection? And
Yeah.
I'll see if maybe she'll allow us to sort of screenshot this and put it on the podcast.
Yeah.
But
We
you
can't,
see,
we
like, can
can't,
you see like the
nah.
little? No, okay.
I can see
Well,
the little colon, but
yeah, there's a
yeah.
little colon. He's so cute.
Yeah, I think CBT, God, I wish I had it earlier. It is such a game changer and it transforms your life. And listen, as a patient, I tried yoga, which is good. I tried acupuncture, which served its purpose. I tried the acupuncture medication, like with Dr. Bantala, with her permission, or Dr. Ha. I tried Ayurvedic medicine. I tried, I'm in LA. There are healers everywhere. They're game changers. I have really good healers, right? Because I'm in Los Angeles, so I got
I
to
was
do
going to say, anybody listening to this from the East Coast, just just we don't have healers on the East
we
Coast.
got everything here in LA, but and yeah, so I tried meditation. I try everything to try to manage a chronic condition. So one, I've been experimental. Two, CBT has been a game changer. Lifestyle wise, what my mom has to do with IBS is that she has to think thoughtfully of her day, where she's going, when she's going, how long the drive is, what's going to induce stress for her, and then calculate where is there a bathroom, how to get to a bathroom, getting exiting. Like when she has that urgency, she's just got to go, right? You can't wait. She's just got to go. And really managing her stress. I just learned in CBT something called spoon theory, and we'll send Caro the visual of it. Spoon theory is awesome. Like how many spoons you got a day? Like 4 spoons to go to the doctor, 1 spoon to like get up, brush your teeth. Like when you have a chronic illness, it tells you in the morning, like you got how many spoons to just get through the day. And sometimes at the end of the day, I'll tell a person, I don't have enough spoons to do this, which is my signal to say, I got nothing left. Because some
Mm.
days, just getting up, brushing my teeth. I mean, I didn't wash my hair for a couple of days last week because I was like, I just got no mojo right now. So spoon theory has been a game changer. And then like you can't be the jackass whisperer anymore. Like you really have to be mindful of who you hang out with because people kind of suck energy like the Dementors from Harry Potter. And people
What
have
do they
heard
call them? Energy vampires or
I
something?
call, yeah, or energy vampires. That's what I talk about in my ecosystem. And the other thing that helped me a lot for these urgencies was I frequently wouldn't make it to the bathroom in time during the height of dark and stormy, during like the really, really bad time with my IBD. So, I don't have it with me, but my friend Beth was like, I was soiling myself. And my friend Beth was like, listen, if you're going to shit all over yourself, you're going to do it in style. And I'm like, what? And so she said, I think I
What a
had
good friend.
it was a damn good friend. So I was carrying this bulky adult diaper bag. Like I just, and let me tell you what was in my diaper bag because it was a game changer. Like I had wipes, which you and I are a big fan of. I had perfume. So, it gets a little stinky. So I needed some type of perfume. I would carry another set of Depends if I needed, right? Like if I, depended upon what I was wearing that day. I would carry yoga pants to change because things get messy. So, and I would get those poop bags that they have for like babies that are powder scented so I could
Hmm.
dispose of whatever it was. And my friend Beth took me to like I splurged. We went to Louis Vuitton and I got myself a nice bag because I needed to look for something that I could Clorox wipe,
Mm.
right? And the canvas bags, I couldn't
Yeah.
Clorox them in the moment because
Yeah.
when you have an accident, you're usually on the floor of a supermarket or a CVS or a,
What does
yeah,
everyone always says? It's like TJ Maxx, right? That's like the
TJ Maxx.
classic one. I don't know. Everyone always says like people are shitting their pants in TJ Maxx.
Dude, I was on many floors. So, because you have to clean yourself up with the wipes, then you have to dispose of stuff, then you have to spray yourself, and then you have to like suit up and get ready to go out there with all those things. But we went to Louis Vuitton. This is back in the day when I could swing it, and we emptied out all the stuff. Like we emptied out the wipes, the perfume, the Depends, the yoga pants, and I would also carry another towel. And then we like measured everything and found the bag that I could also Clorox and destroy. And it went with me everywhere. And she was like, don't come from this from an angle of shame. Come from this of like, hey, this is a situation, like we got to handle it. And like I would have emergency exits, like when I'd come back, the parentals knew keep the garage door open. I'd have to shed my clothes really quickly, change in the laundry room, run upstairs, take a shower. But it was like, she's like, if you're going to do this, you're going to do it in style. Like, you're going to
Well, I
look
mean,
good.
yeah. I mean, you're telling, what you're saying is like empower yourself, you don't you don't have to go through this floundering, right? Obviously, we're going to try to help people not have to be like that, but that doesn't always happen instantaneously. And so, like you said, I mean, your terrible era was years. We're not talking about a week, that you went through this for years. And inflammatory bowel disease is a lifelong condition, as is many times irritable bowel syndrome. And so there's going to be bad times and good times. And, I want people to feel good all the time, but that's not realistic. And so when you're having bad times, empower yourself to at least feel human as you can during those times, right?
Yeah.
Because being on a floor without a change of clothes in a Walmart is probably my worst nightmare.
Yeah.
And you've lived it,
A
and
lot of
so
floors.
it's important, yeah, it's important that you speak about it because people need to know that this is people's reality and we need to be like understanding of what's happening in people's lives.
Yeah, the other thing I do a lot of is if I don't have enough spoons, like I'm lucky now, I've had to communicate that I can't commit, right? Like if you have a bad day, you have a bad day. And driving, that costs some spoons if you're in traffic, or sometimes I'll get anxiety if there's too much traffic. So I've now had to reformat my schedule where I miss peaks of
Mm,
traffic because I feel trapped and I can't exit and I can't get to a bathroom, right? Or even when I sit on a plane, I want to be on the aisle seat because I need to be able to get to the restroom as soon as possible. Same thing with concerts. My sister knows, like, when we book our concert tickets, I need an aisle seat because I need to be able to, like, get out.
hmm
But those are the things that, like, you learn a lot about yourself, but the only way you learn, I love what you said about empowerment, is that you go out, you try, and then you're like, okay, here's what's going to work for me, and here's what's not going to work for me.
hmm
And then you got to communicate it because people are like, what's wrong with you? Like, why can't you do this? And I'm like, dude, if I have to explain myself, it's
Right.
tiring.
It
It's
is.
really
It's
tiring.
exhausting. I mean,
Yeah.
it is. And not to mention like literally draining, going through stuff like that because not just emotionally, but literally physically, you can get dehydrated and electrolyte disturbances. So it literally is draining.
Yeah. Nothing but compassion for IBS and IBD patients. This was super helpful. Anything else or anything else I'm missing about the patient experience that you've heard me say?
Well, I mean, I just think, we've talked a lot about a lot of things, right? We've talked about psychotherapy. We've talked about other, like a million other healers and adjunctive therapy. We've talked about medications. We've talked about diet. We've talked about probiotics and other supplements. We've talked about shopping and bags and wipe brands. So I think, the point of that is that it's so multifactorial.
Yeah.
And it's not just, I wish a patient would come in with all this thing and I could be like, oh, well, how about I just, give you this pill, this, antibiotic for 2 weeks and your life will be. It's not like that. IBS is not strep throat, right? It doesn't work like that. And a chronic condition requires chronic treatment, and that is super multimodal and every area of your life. It's what you eat, it's what you do, it's what you wear, it's where you go, it's who you associate with. And so it affects every part of who you are. And, my job as a doctor, it can only, it's to understand that, to help with what I can, but then sort of empower you to be able to feel comfortable seeking help in all those other areas too. Surround yourself with the right support. Find a nutritionist that you like. If you are feeling like you want to see an herbalist, find somebody you're comfortable with there. But maintain good relationships with your physician as well, because I think that's kind of the nuts and bolts.
Yeah. No, I appreciate what you just said. And even right now, this week, so Dr. Patel, she's a friend of mine. I was feeling pretty low about my fashion choices because I was always in yoga pants. And then she's an ER doctor out in Long Island, and she said, "Hey, Son, have you ever thought about wearing maternity jeans?" And I was like, "Oh my God, what a game changer!" And this week, Dr. Soyka heard me because I'm having a tough health challenge, and she sent me the cutest, like sweat. What are they? Sweatpant jeans?
Listen, I bet like if you do not have, okay, so now granted they are expensive, so they are not cheap,
I found a
but
cheaper brand,
oh, you
but
found a cheaper brand?
I
But
did.
so there's lots of stuff, lots of brands then, but the sweatpant jeans, especially the wide leg sweatpant jeans, high rise, let me tell you, ladies, game changer. Like total game changer. You look so put together and you are so comfy. So I love them.
Yeah, so we're gonna have a whole show about fashion and what you can do because as a patient, you want to feel that you have some control in a situation that many of the times is uncontrollable. And you do have to accept where you are. And I don't want to say make friends with your chronic condition, but you have to get to a level of like acceptance and how am I going to deal with it. So Dr. Soika and Dr. Kareem sent me these two pair of jeans and pants because maternity jeans, a lot of them are the skinny ones or they've got that baby bump, the big ones, and that doesn't always work. But it alleviates any pressure on the tummy for me. So I'm so excited because I can look fashionable and comfortable and just feel more put together, like when you're going through something and you don't feel very put together. So we'll talk more about CBT, fashion. I want to also hear more about these fecal transplants. That's a whole nother episode. But thanks, friend. I appreciate our time together and thanks for listening.
Yeah, thank you guys so much for joining us today and have a good weekend if you're listening to this on the weekend, and if you're not, I hope you have a good weekend whenever it is.
All right, bye. Mwah.
Bye.